of the chest is due to congestion of the heart, due to high blood pressure, or due to congestion of the heart due to fat, due to cholesterol, and it can trigger. It can even lead to heart failure or heart attack. Those are the things. When you go for regular, they will tell you your health status. Then you'll be able to take care of yourself, and you can prevent preventable deaths. There are some deaths that can be preventable due to from the outcome of regular medical checkup. That's the essence of it. That they say prevention is better and cheaper than cure. So when you are doing regular medical checkup, you'll be able to keep yourself healthy and stable health, and live a healthy lifestyle, and also live long. Longevity is the hallmark of living, having this regular health check, at your own disposal.
Thank you so much, Achoze Elizabeth. You agree with me that she said a whole lot there, and just like we normally say that health-conscious people live longer. So when you always have your regular health checks, trust me when I say you'll be doing yourself a whole lot of good, and you'll be saving a lot of money. But at least it's also good you know what is happening to your body. Moving on, we're going to be catching up with a recap of the interview with Dr. Nta Ch10. He talked about Lassa fever, signs and symptoms, and of course, preventive measures. Take a look. We'll be right back. Our guest in the studio today, we're talking about Lassa fever, and with me is Dr. Nta Ch10.
Thank you so much, Nkem.
You're welcome to Health Watch. Thank you for showing up in a very short time, and you just said, okay, I'll be on the show. Thank you for coming on the program.
Yeah, okay, you're welcome.
Okay, talking about Lassa fever, what is Lassa fever and what are the causes of Lassa fever?
Okay, thank you so much, Nkem. So Lassa fever is a viral hemorrhagic illness. So when I mean viral, I mean it's a virus itself. So an hemorrhagic means that one of the symptoms that Lassa fever can cause in anybody is bleeding. Okay. So, but it's not, that comes in extreme cases, and it's an illness because it's an infection, it's a disease. And usually the major cause of Lassa fever is usually gotten from rats. So a major species of the rats is multi-mammate rats. So multi-mammate rats are rats that have a lot of breasts or mammary glands. So
you mean the female rat?
Exactly, the female rat. So the female rat. So and people can get it. It's usually gotten from the urine and feces and droppings of rats. So maybe in open foods or in various places or in the environment or so. So it could be gotten from there. And even when there's inhalation or when it's taken in like air. So from the urine and the feces also, it could also Lassa fever can also be
as air.
Yeah,
how is that possible?
So for example, wherever there's a location in an environment where a lot of rats are and a lot of poo, a lot of urine and something, and people are playing around and try and inhale the air or so, that could also lead to contamination as well. And it could be transmitted from humans to humans. Especially, it has been shown that there have been increasing cases of infection in healthcare practitioners. So it can be gotten and transmitted from humans to humans. In an infected person with Lassa fever can transmit it to another person that does not have Lassa fever. And this can be done through exchange of body fluids. So like could be through saliva, through blood or something. So that can also cause the infection.
I'd like it to be specific. Through saliva, is it through kissing or what so happens?
It could be through kissing, it could be through...
You peck your child?
There could be a peck of child, there could be a needle prick or something. So basically anything that exchanges body fluids between the infected person and the person that doesn't have Lassa fever can also cause that.
Okay, one very strange thing about Lassa fever is the fact that it's every year. We talk about it every year. So I don't know if I should term it as a pandemic, because for COVID and Ebola, there was so much awareness going out. Everybody was very conscious of it. People are very careful. Don't sit close to me. I have my nose mask and all of that. Yeah. So for Lassa fever, I feel like one moment is out there, everybody's trying to be careful. One moment, we're not talking about it anymore. So why is this so? Is there a period or something?
Yeah, so the truth about Lassa fever is that it's a public health concern. So that's one. And it has actually been existing for quite some time in Nigeria since 1969 or so. And we have major states that have a huge burden of this Lassa fever. So we have like Bauchi, we have Edo, Ondo. Lagos itself doesn't really have a lot of cases of Lassa fever, although the Commissioner for Health recently declared its red alert, so that we should take more caution in that. So it's a growing endemic issue and public health concern, because there are cases where we have had people that have Lassa fever that have traveled to other countries that don't have Lassa fever, and it's becoming a growing concern because other people can get it, because as I initially said, it can be transmitted from one human to another. Okay, so it's basically an issue because there's no awareness, there's no proper awareness, and there are cases where some of the initial presentations like fever, headache, and weakness can be mistaken for malaria or typhoid. Okay, and when you're not really paying much attention to that, so someone can mistake it as malaria. So, and when there's that exchange of body fluid, there are more increasing cases of Lassa fever. And in Lagos, we have a whole lot of people. The population in Lagos is quite a whole lot. Absolutely. So even if we don't have so much cases, so people coming from Bauchi, where the Lassa fever is quite endemic, so it increases the number of cases. So we have, so well, it's in West Africa we have a lot of cases, but as it keeps on increasing, it becomes a very huge public health concern.
Okay, let's talk about mode of transmission. I know that you've explained a lot, basically, but because we are a grassroots station, I'd like people to understand how. So I'm going to give you an example. I remember that there was a time there was an outbreak of Lassa fever, and everybody was saying, stop drinking Gary, stop drinking Gary. And I'm like, in Lagos, everybody drinks Gary, excuse me, how am I going to do that? So tell us, when you say mode of transmission, how do you explain to the person in the market, this is what happened? If the rat is here, if the rat does this, this is what happens. So. Okay,
thank you so much, Nkem. So a very important way in which Lassa fever can be transmitted is, as I initially said, is through the urine and feces contamination. Okay, so when people have open foods, so like you leaving the Gary out, so open various foods, sardine and several other things.
Like the sellers now, right? So in, like their shops.
So like in their shops and even at home too. Okay. So in homes where are not the sanitation is not proper, so where is not the environment is not looking tidy and not clean, so it gives an opportunity for some of these rats to come and populate that place. So and so where there's contamination of some of these foods and all, so the rats come, perch, so where they have their feces and they have their urines there. So when someone takes in those food, so it's being infected with Lassa fever. So, and a person infected with Lassa fever can transmit to another person, so that does not have Lassa fever, probably could be through kissing, maybe you have a cut or something, that person has a cut, there's an exchange of blood. Or anything that could cause an exchange of fluids between the infected person and non-infected person.
So can you share a spoon? I want us to come to the level where people can actually understand what you're doing. So we're eating, you're my friend, and we're having this meal in the office, and I'm like, let me taste. Okay. And you don't know the person has Lassa fever.
Yeah, so
can you contact each other?
Yeah, so sharing spoon itself does not give Lassa fever, but there are cases where maybe a person has an injury inside the mouth. Okay, and maybe you're sharing spoon, and maybe the saliva from the person that has Lassa fever drops on the spoon, and the person that doesn't have Lassa fever now takes it in. So if there's any entry point into the body or into the blood, so the person can get Lassa fever itself. So as we normally say in health, so public health concern, we say prevention is better than cure.
Cheaper.
So in any way you can to avoid that, just try as much as possible to avoid that.
Okay, Lassa fever has always been described as a very fatal disease. And when you say fatal, I think that one of the issues we had when we were creating awareness of HIV, right, was putting that skeletal image, and everybody's like, hey, I don't want to have HIV. so I see these pictures of Lassa fever, and I see someone is sweating, and you just see blood drop, and I'm like, is there anything like this? So what are the signs and symptoms to look out for, the worrisome signs that when you see this, you know, this is not malaria, I need to go to the hospital, all right?
All right, so interestingly, a lot of cases, like let's say you have 10 people that are confirmed to have Lassa fever. So about 8 of them will most likely not have any symptom like no presentation. So roughly, if I'm to give it a percentage, I'll say about 80% of people don't really have anything or any concern. So that's for one. And if someone presents with a symptom or someone has any issue or clinical features, so some of the things that they can present with, the person can have a high temperature, so that's like fever. Person can be weak, can be very tired, can have fatigue, so can be very tired and have headache. And sometimes people can mix it with malaria. So because that has been a huge concern for us doctors, because sometimes when these patients come and see us, we're not really sure whether this is malaria or typhoid, and even the person that has the fever or weakness or even headache is not even sure whether this is malaria. But most times when you are taking anti-malaria drugs and the fever is not coming down, that is a very huge concern and the person has to present. But extreme cases where it becomes quite serious, the other presentations could be the patient might be bleeding, whoever has it, the infected person might be bleeding, the infected person might have sore throats, might have swelling in the face. So, and the infected person might also have chest pain, body pain too, is also another presentation for that patient.
So how long will it take for you to see all of the signs? So for example, for chickenpox, some of the times you have chickenpox, you're just having fever, and it gives you like 2-3 days, you start to see it come out, you know, you see those, you know, the balls and all of that. So how long will it take for you to start exhibiting the symptoms? Okay,
so usually in most cases, in about a week, so a lot of them present with some of these things. And as I said initially, some of them might not present with anything. It might take a while. But usually people come up with fever, which are most of the cases in about a week or so.
So okay, so how do we prevent just like you said, prevention is better
than cure.
Let me add, cheaper than cure. So how do you prevent the spread of Lassa fever in homes, in communities, knowing that we are in a city where everything is happening at the same time, all right? Everybody's going to work, you get to sit near people, and you're trying to be comfortable, you're trying to be careful at the same time. So how do you prevent all of this?
Okay, thank you so much. So a very good way to, various ways that Lassa fever can be prevented, so is first and foremost, I'm very happy that in Lagos State we have days where there's proper sanitation. So a very important thing is to ensure a proper environmental sanitation where the environment is very clean. Because a very clean environment doesn't give opportunity for these rats to come and populate that place. So, and some houses and some homes have holes in the walls. So it's best to block those holes, because when those holes are blocked, so it does not give an opportunity for the rats to come into the environment. So blocking the holes. And for the food stuff that we store, it's very important to cover them. So cover them tightly, keep them safe, because keep them safe and try as much as possible to ensure that even the environment where they are, it's very clean. So another important thing is, which I tell a lot of people is, whenever there's a dead rat around in the environment, try as much as possible not to handle them with a bare hand.
Wow.
Yes, so if there's
even when the rat is dead?
Even when the rat is dead. Okay. So try as much as possible not to handle them with bare hand to avoid transmission of that Lassa fever.
Wow.
Yes.
Very important information.
Yes, so then if there's any major issue, they can call the local health authority. So any major concern, so NCDC has the hotline, that's 6232. So if there's any concern, just reach out.
So when you say local health authority, what are they?
So local health authority, like the National Center for Disease Control, and then so National Center for Disease Control. If there's any general hospitals around, then anybody that they can reach out to, any local health clinics around, so that they can go if there are any initial symptoms that they present with. So
what about the shops in the community? Because your home is very clean, you've done everything that Dr. Sumta has said today, but you still come back home with gari, you still come back home with canned drinks, and you come back with Lassa fever.
So for the shops, if there can be a regulation from the government itself, environmental, because I know some environmental laws are trying to see how best they could regulate sanitation. So sanitation is one of the most important things in which Lassa fever can be prevented. So for the shops, the best way is there's proper sanitation in the shops or in the environment of the shops. And it's the same thing that applies to the home that applies to the shop. So even some of these foodstuffs that they have, because I know some of them have bag of rice that they use to cover some of their food.
I mean the daily thing. So you need to cover.
So
Come back tomorrow. Bring out the gari again.
Yes. So and some of the issues that some of them have is some of these things are not covered.
Okay.
Okay. Even the ones that they keep inside the shop, so are also not covered. Okay. And if they have holes in their shops too, they can cover that to reduce the population of those rats too. Then other things they can do is to be very much sure to inspect what they sell to people.
Okay.
So to check through if there are feces, if there are anything that they could pick, so cleanly, in a clean way, and try as much as possible to dispose it. So, because a lot of us, when we're hungry, we just try to get this and let's see how we could eat.
Especially for those that love to drink gari.
Exactly, a lot of us. Yes.
So okay, coming down to one question, I know a lot of people will be asking: can it be treated? You know, once you know this can be treated, even when you try to do all your own bits, at least you know that it can be treated and you present on time. So can it be treated? And if it can, what's the process? What's involved? All right.
Okay. So usually when people present to the hospital, there's a major treatment for this. Okay, because I initially said it's a viral disease, a viral infection. So usually viral infections are treated with antiviral agents. Okay. So antivirus drugs. So the major antivirus drug for Lassa fever is ribavirin. Okay. So ribavirin is the major drug that they use, and ribavirin is more effective usually in a week. Okay. So of treatment or of the presentation.
So under a week you're better.
Exactly.
You're a little bit stable.
Exactly. So ribavirin is the major one. So, but sometimes when a patient can present, like if someone has fever, you take drugs that can help calm the fever. If someone has cough, you take drugs that control it. Yeah. So then if one is bleeding, so the best thing is to give the person fluids that could help to replace what has been lost.
Lost fluids.
So lost fluids. So there are other ways to control that. So like fluids, oxygen if the person is not breathing so well, and some other things. But the major one is ribavirin.
But the important thing is that within a week or two you're better.
Exactly.
You're back on your feet. That's if you present. Exactly. Okay, Dr. Soms, very quickly, in 30 seconds, what's your message to Lagosians?
Okay, thank you. All right, so to my fellow Lagosians, as I initially said, the major thing is prevention is better than cure. And as much as possible, let's see how well we could sanitize our environment to properly clean, and try as much as possible not to handle the rats with bare hands. And if there's any major concern, like if there's a fever, and you're taking your anti-malarials and it's not being controlled, and try as much as possible to go to the nearest health care facility and get your care, because early detection of this disease is very much important to help control Lassa fever in our community. And if there's any other concern, try and report to the local health authority, and there's an NCDC hotline 6232, and reach out to them and get the best care.
Wow. And that's where we draw the curtains on this week's edition of Health Watch. Remember that I normally say health conscious people live longer. Trust me when I say it was really expressed in the two interviews we had today. First on medical checks, and of course to Lassa fever. Please stay safe. You have questions, you have inquiries, you'd love to sponsor this program because of course you want to keep this program on air. Please reach out to us on 07060865487 or send an email to okibeinkem@gmail.com. A big shout out to all my crew members that ensure that this program comes on air every week. My director, Yusuf, and of course all the production assistants, all the engineers, thank you so much. My name is Nkem or Kibe. To come your way